HEALTHCAREONOMICS, changing healthcare by changing the way you think about healthcare.
Well, hello, everyone. Welcome to the Shannon Joy Show. We are broadcasting from the Joy Family Bunker. I am joined by my good friend, Dr. Kevin Wacasey out of Texas. He has written the book on healthcare and economics. It's called HEALTHCAREONOMICS. You can find him on Twitter. His handle is @HCOnomics. And I'm so glad you're here with us. We have so much to talk about tonight, Dr. Wacasey.
Yes, we do. We absolutely do.
So before we start, though, I have a really funny story.
Okay.
On the radio program, we're going to feature a video, kind of a jaw-dropper video. It's a hot mic episode with John Roberts of Fox News and what appears to be a Fox News staffer, maybe a White House staffer. I'm not sure who this person is. And you did a quick little 1-minute video about that. After you got off your shift, you're working as an ER. You're working in the emergency room right now. And you did a little video. So I posted the video on my social media, on my Twitter account and my Facebook account. And I just have to tell you, Dr. Wacasey, the ladies on Facebook think that you're dreamy. Apparently think you're very dreamy because I post the video, and it's a very serious video. We're talking about serious topics, but my girl Ruth and my girl Lisa, Lisa goes, "Oh, I like this Dr. Wacasey," and then Ruth is, "Yeah, he's really good looking." And so the girls on Facebook, now I don't know if you know this, but my husband is a psychologist. He's a PhD, and he has a practice, so he's devastatingly handsome Dr. Joy. That's my name for him on the program. And so the girls on Facebook said, they're like, it was so cute. So they're going back and forth, and they said, they're like, "We think Shannon Joy has cornered the market on devastatingly handsome doctors."
I will definitely take that as a compliment. I need that as a compliment. So
Right?
great. Thank you so much.
Now, in all fairness to Dr. Joy, I mean, he has the devastatingly handsome moniker, though. I can't take that away.
Sure,
He's my
sure.
number one. So I think from now on the radio program, you're going to be the gosh darn handsome Dr. Wacasey.
I'll take it.
For whatever, because I can't take devastatingly handsome from Dr. He'd be mad at me,
I promise. If you could see me blushing, you'd know this isn't pre-planned, folks.
I just loved, I thought I'd make you blush before we started the interview.
Thank you.
I thought that was really cute and really sweet.
I appreciate it very much.
So let's get in. Let's start with the video because we have a lot to get to today. We're going to talk about face masks. We're going to talk about the healthcare system. We're going to talk hopefully about the Stanford study. Dr. Wacasey is a practicing physician, and you're also currently working in the emergency room, right? You're filling in right now because the ER doctor has retired suddenly, and now you're working hard.
Yeah. I got a temporary assignment to a rural emergency department out in West Texas when one of the physicians, who was near retirement anyway, suddenly decided a couple of weeks ago that COVID-19 was it for him. He was just going to hit the trails, as we say out here in Texas. So yeah.
Yeah. Well, let's start with the video that you posted. You can find Dr. Wacasey and all of his YouTube videos at HEALTHCAREONOMICS on YouTube. And you posted a video as a hot mic situation where John Roberts was in, it looked like the press briefing room. It was in the White House.
Yes.
And they were getting ready. They were either getting ready to go on air, and he is engaging with what appears to be either a Fox staffer or a White House staffer. And this is the engagement. This is what was picked up on the hot mic, which really dropped a lot of jaws across the country. So let's go ahead with that soundbite.
What's up, Barry?
All right, man.
What do you know, babe?
You can take out the mask, Doug. The case fatality rate's like 0.1 to 0.3 according to
Is it really? That's reassuring.
USC.
Everybody here's been vaccinated anyway.
USC.
Everybody here's been vaccinated anyway.
USC.
Everybody here's been vaccinated anyway.
Everybody here has been vaccinated. Dr. Wacasey, what? So I'm just confused.
Me too.
I'm confused by this. What are your thoughts? Your immediate thoughts to that soundbite?
Well, my immediate thought was, what did I just hear? And I had to replay it. And I actually got this off of a tweet from the Golden State Times. I think that was the name of the media organization. Shout out to them. Thank you very much for this. And I took that video and then I edited it a little bit to illustrate what that gentleman was saying over and over again about, the we've all been vaccinated here. And I was shocked, and not much was made mention of that in the original tweet. And then, as the day has unfolded and I've gotten a lot of feedback on my and on your timeline as well, there have been some people who've said, well, obviously he was joking. Well, it's not obvious to me that he was joking. I mean, maybe, I've done a couple of videos lately about taking things out of context. And so, of course, none of us were in the room. We don't know what was going on. You can't see his face behind that mask, obviously, in the video clip. And so maybe he was joking. Maybe this was workplace banter. I don't know. I would like someone to clarify this for us, because if he wasn't joking, then the implications are that either he could have been mistaken. Perhaps it was the flu that they've been vaccinated for. Although I would hesitate to say that all people anywhere have been vaccinated for the flu, given the resistance to flu vaccines that we see commonly here in the U.S. So I don't think that it was that. And that leaves, that rules out all possibilities except the idea that perhaps there is a coronavirus vaccine. Perhaps, maybe. And perhaps the White House staffers have received it. Maybe that's why President Trump doesn't wear a mask and doesn't observe social distancing up there on the podium with his cohorts like he's supposed to. Or it could be that they've all been tested and tested negative for this. I don't know. But, I'm not going to pretend to know the answer to this question, but it just leaves me again with, as virtually everything has with this latest, what I call, remember, Shannon, I call this a panicdemic. I'm left with far more questions than I am answers. And as time is going by, it's been a couple of weeks since we spoke about this, but time is proving that what I said back in late March in this video I did on YouTube called The Coronavirus Panicdemic of 2020, what I said was pretty much spot on. And it's not that I am smarter than anyone else, folks. Don't think that of me. I'm not being arrogant. I just put some math together. I just did some numbers and crunched some numbers and figured out that, hey, based upon these estimated cases versus fatalities and everything else, this disease isn't nearly as deadly as we were led to believe in the beginning phases. And in fact, it's not nearly as deadly as some news outlets are still continuing to portray it as. And so when he said that there was a coronavirus vaccine, or he said that we've all been vaccinated here, obviously the first question is, was it joking? Was he joking? And I don't think he was. I think that was said in all earnestness. And then number two is, what exactly was he speaking about being vaccinated against? Those are very important questions. And I would just like to hear somebody in the media ask those questions. I haven't had a chance tonight to look, but I would love to hear that asked and answered.
Well, that is being asked of John Roberts on Twitter as we speak. This is beginning to gain a little bit of momentum. And I think anyone with journalistic integrity, anyone with an ounce of curiosity would ask them to clarify what happened during that exchange. That's not even mentioning the fact that John Roberts is coming in and saying, hey, take your mask off. We're watching wall-to-wall coverage, NBC, CBS, ABC,
right.
New York Times, Fox News, wear your masks, wear your masks. And then you have, don't wear your masks, because it's almost as if they know something that we don't know, or there is information that is being withheld that not only people in the White House and in that inner circle know about, but also members of the media knows about as well. And I just think that this is when you should be asking more questions. And I said this to one of our Twitter followers who immediately said, well, they were just joking. Well, there's no evidence that they were joking. And rather than just assuming that they were joking, any journalist with integrity and with curiosity would then take that next step and say, what did you mean by that? And then ask those other questions. Is there a coronavirus vaccine? Has anyone in the White House been vaccinated? I mean, what and ask those next follow-up questions, because there has been speculation that, and we know Bill and Melinda Gates Foundation, along with a whole host of other massive billion-dollar global organizations and corporations have been really intent upon developing a vaccine. And that's, that's one of the things that they've been pushing for quite some time. Are they further along in this than they've let on? Are they withholding a vaccine from the American people when they actually have something? I mean, these are all questions that
Sure.
I think are reasonable.
Important. Yeah.
That should be asked.
Yeah, absolutely.
All right. So we're going to have to go to, okay, let's go to break now. Okay. And when we come back, because the other part of that video there, I mean, the two elements, the first was the vaccine, but the second part of that video, or the second part was the vaccine, but the first part was this kind of general knowledge that you don't have to wear a mask anymore. Right. Well,
Yeah.
here in New York State, it is, I mean, Andrew Cuomo has basically sent the edict out that everyone in New York, if you're walking your dog, if you're going out for a little fresh air, if you go to the gas station, the CVS, the Wegmans, any of the stores, you must wear face masks.
Yeah.
Anyone and everyone. And they're also beginning, as they start to allow us to reopen in New York State, some of the stipulations are that employees have to be wearing face masks all day long. In order to go out into the community at large, you have to be wearing a face mask. And I have to tell you, I don't think I have ever gotten so much pushback on anything because I am not wearing a mask, and I believe it is my constitutional right to not wear a mask. But let me tell you, it's been hot. I kicked a hornet's nest on this one. So when we come back, we're going to have the good doctor tell us a little bit about the face mask thing because, I think people have questioned me about that, and I want to get the details. We're joined by Dr. Kevin Wacasey. He is an author and a practicing physician. You can find him on Twitter. His handle is @HCOnomics. We'll be back in a moment on the Shannon Joy Show. Well, hello, everyone. Welcome back to the Shannon Joy Show. I'm joined tonight by Dr. Kevin Wacasey. He is the author of The Guide to Buying Health Insurance and Healthcare. He also wrote HEALTHCAREONOMICS. He does a series of YouTube videos, and he's also on Twitter. His handle is @HCOnomics. Welcome to the program. And we're going to be talking face masks in a moment. But Dr. Wacasey, you wanted to make one more comment about a potential COVID-19 vaccine and this apparent hot mic moment when it looked like a Fox News staffer had mentioned to John Roberts at a period of time when there was really the camera, obviously the mic was on, but they weren't broadcasting the statement that everyone had already been for COVID-19. So what was your comment on that you wanted to finish up with?
Yeah, what the gentleman said was, we've all been vaccinated here already. Now, we don't know of what vaccine he was talking about, but I have to say, in the realm of possibilities, it is entirely possible that there is a coronavirus vaccine. Coronaviruses, after all, are very common viruses. The one that's out now that's causing all the mayhem is just the latest one to come along, one of a number of these things. And in fact, coronaviruses are very common. If you've ever had a cold before, the chances are you may have had a coronavirus at some point in the past. So this is not a new family of viruses, and they all share certain characteristics. That's why they belong to this coronavirus family. So I am positive that modern science has been working on a vaccine against these coronaviruses for a long, long time, especially since the SARS and MERS epidemics occurred several years ago, and those were really lethal coronaviruses, unlike this SARS-CoV-2 or the one that causes COVID-19, doesn't appear to be nearly as lethal as those two were. So, it's entirely possible that they have developed a vaccine for this. And it's, it just hasn't probably met FDA approval. That has to go through a rigorous trial or what have you. So it's plausible that if they have developed a vaccine, perhaps they fast-tracked it and gave it to the VIPs within the government. I don't know. I don't know why the media, the press corps would get it, but, they come in contact with the president routinely, so perhaps they got it. So that's an entirely plausible theory. It would be shocking, though, nonetheless, if they had developed it because they just haven't announced it. And that's why I'd like to see that question answered, whether it was a joke or not. What's going on?
Let's be quite honest, okay? Every Democratic and quite frankly Republican tyrant that really seems to be enjoying this kind of, dip the toe into the dictatorship pool kind of thing, they're enjoying. It seems like they're enjoying this a little bit too much. And let me tell you, they're getting, it is every wish list that they could ever imagine. Massive stimulus packages, massive amounts of pork. They are really putting the screws to small and medium-sized businesses that are harder to control. And so, a lot of this in a kind of a sick and twisted way is playing into, the dictator dreams of a lot of people who are in positions of power. And so you could, I mean, it would not surprise me if they wanted, if they enjoyed having this and, well, maybe we'll wait on this. I don't know. I mean, this is all speculation and I don't want to speculate, but the question definitely does need to be asked. Now, the first part of that video was also interesting. John Roberts saying, hey, you don't need your mask anymore. And now I've been known to kick hornets' nests, Dr. Wacasey. I do it sometimes inadvertently.
I think that's why we like each other, Shannon. Yeah.
Sometimes I'm just being myself and I'm just doing what I normally do. And I tend to be a bit contrarian and I ask questions and I don't just allow people to ladle me their talking points. And so, but this whole idea, Andrew Cuomo last week, it seems like his MO is every time we get good news, he clamps down on us harder.
Yeah.
So we're bending the curve. We have a lower rate of infections, lower rate of ICU, lower rate of respirators. I mean, all the news is good, but he acts in the opposite way of like clamping down even harder. Last week on Friday, the statewide edict went out. It was an executive order. You shall wear face masks everywhere you go. Now, I don't think, I came out publicly and said that I will not be wearing a face mask. I believe that it's a violation of my constitutional rights and my liberties. I have some other reasons that hopefully we'll get to a little bit later in the program. I think this could potentially be just the first step to a whole lot of other things that the government wants us to do in order to engage in society. Yeah. It's almost as if they put us in prison. We've been locked up now for 6 or 7 weeks. We have Stockholm syndrome and we want someone to rescue us. And we're basically saying, we'll do anything. Well, you want us to put on a mask? You want us to put pins on our head?
Mask. Yeah,
right.
Yeah.
You want us to be tested? You want us to take a vaccine? And this could go to a dark place if we allow it. And so for me, it was just a line in the sand. Now, every time I go out, I bring a copy of the executive order with me. And
good.
It's very clear on the executive order that if you are medically able to tolerate a face mask, they're recommending that you use one. But if you're not, then you don't have to. So if you have trouble breathing, if you have anxiety, if you have, issues with wearing a mask or covering your face, I think that it's perfectly reasonable to decline to wear the mask. In addition to that, it also says specifically in the executive order that the mask is only necessary unless you are unable to maintain the proper 6 feet social distancing. So when I go out, I stay 6 feet away from people and I don't wear my mask. I get a lot of dirty looks. It's very weird. Yeah. I'm going to tell you, it's very strange. People look like they want to murder me. I mean, they bought into the myth. Not happy with this. Yeah. I also believe that the masks don't do diddly squat to keep you safe or to keep anyone else safe. And this is one of the reasons I'm really glad that you're on the program, because I wanted to clarify, because I'm getting hammered on social media, and it's even the nasty stuff. I hope you die. I hope your kids die. You deserve to get COVID. Darwinism.
Wow.
People are going. This is no joke. So I wanted to get from a real bona fide doctor a discussion on these face masks and whether or not they are necessary. So why don't you go ahead?
Well, the question is, okay, so here endeth the speculation. All right, here beginneth real hard truth science. And perhaps a physician is not the best person to answer this. We really should be talking to an engineer, because what masks are is filtration devices. They're no different than, say, the air filter on your air conditioning unit at home or on your car, the oil filter that circulates oil through it and catches all the gunk to keep your engine clean. These masks are nothing but filters. And as filters go, what you need to ask is not whether a filter is necessary, or I should say that equally important as that question is, does the filter work? Does it do what it says it's going to do? And with regards to these masks, especially the homemade cloth masks. That seems to be the latest YouTube fashion. These has-been celebrities are finding new relevance by coming up with how-to videos, how to fold a handkerchief properly and make a cloth mask out of it. That is useless. Okay, it's useless. The surgical masks that even I'm required to wear in the hospital environment now, and I'm not required to wear it. I'm required to wear it by hospital policy. Given my druthers, I throw the things in the trash. They are absolutely useless. They will protect me if someone spits or sneezes or throws up in my general direction. They're not going to protect me at all from something as small as a virus because they do not filter these things out. And this is something that we need to get into in the next segment, I think, because it's just there's a lot to discuss here, but it boils down to filtration. And let me tell you, even these N95s that are being hoarded and sold for gobs of money, and they don't work. Okay, they will not prevent the coronavirus from getting into you. Sorry to say that.
All right. Well, we got that straight from the horse's mouth. Dr. Kevin Wacasey. He is the author of HEALTHCAREONOMICS. You can find him on YouTube at HEALTHCAREONOMICS. Also on Twitter, his handle is at HCOnomics. We'll be back in a moment right here on News Radio WHAM 1180. Welcome back, everyone, to the Shannon Joy Show. Happy Tuesday. So pleased to have Dr. Wacasey joining me tonight. We are talking face masks. It is the debate of the day in New York State. Anyone and everyone who ventures out into the world must wear, according to King Andrew Cuomo, a mask of their own making. So it's, a bandana. People look like the bandits from a country western, film from the 1950s with the bandanas over their faces. And then if you go out, you're not wearing a mask. You get all kinds of dirty looks. People look like I have three heads, but it's the weirdest thing. I wanted to have you on to talk about whether or not these masks actually work, and So let's go to that first. You said in the last segment the answer is no.
So I'm from Texas, and those people you're talking about with the bandanas around their faces are rustlers. And cattle rustlers, and masks are pretty good at protecting the identity of a rustler. A bandana wrapped around a New Yorker's face does diddly nothing to protect them from coronavirus. Let me just get that out there.
Zero.
Zero.
Nada.
You're making a bold fashion statement. That's about it.
You're virtue signaling that you care about people.
Yeah, well, you're doing what Simon says, basically. And again, we started talking about filters last segment. And really what this boils down to is these masks are supposed to act as filtration devices. Now, imagine you're trying to you cook some rice, and it's all wet, and you want to drain it. So you put it into a colander or a sieve, something with very tiny holes where the water will escape, but the rice grains don't. You want the rice for your dinner. Okay, fine. Now imagine trying to filter out that rice with chicken wire. It's not going to happen. You're going to lose your dinner down the sink because that rice is much tinier than the holes between there. I don't even know if you call them holes in chicken wire. It's just wire. So the bottom line is that these masks that they have promoted by the government, the media, all the virtue signaling, do-gooders out there are useless. Even the N95 masks. And let me explain why. Viruses, when it comes down to it, the size of an average virus is, we like to use, in medical terms, we use a very sophisticated term. It's called extremely small. Okay. These viruses are so teeny tiny that millions of them would fit onto the head of your finger. They're onto your fingernail, your thumbnail. These things are incredibly tiny. And in fact, they're so small that they are measured by units called micrometers or microns. And this is a millionth of a meter. Okay, this is very, very teeny tiny. This measurement is smaller than the amount of ethics that most politicians possess. I'm just saying, this is really small. Okay. So the bottom line is these viruses are so small, they just waft right through. It's like trying to filter rice with chicken wire. And if you have a mask made out of cloth, a bandana, say you're a rustler, you can spit your, if you spit your Dr. Pepper through your nose after you laugh real hard at a friend's joke, and that water comes on the other side of that bandana. Well, hey, man, if if it's going through there, then it's not doing a very good job of protecting you
Right.
against something as teeny as a virus. Now, let's talk about. So let's just get out there that cloth does nothing to protect you against these airborne and aerosolized viruses like coronavirus, this latest coronavirus. So now let's talk about the medical grade. Let's talk about the surgical masks that are out there. Surgical masks are almost as worthless. In fact, I dug up one study, an actual study that was done scientifically looking at this, and they estimated that between 20 and 80% of viruses, large viruses, not small viruses, but larger viruses, on the order of 50 to 80 microns in diameter, were getting through these masks. In other words, even with the best made surgical mask out there, fit tight against your face. That's the other thing, is you can't just cover your mouth with this. It has to form an air seal over your mouth and your nose for it to be effective. Anybody with a beard who puts on a mask, forget about it. I think that's a New York thing, right? Forget about it. Yeah,
New York
it's not
City.
working.
We're upstate, Dr. Wacasey. We're not New
Oh,
York
excuse
City.
me,
Very,
excuse me.
very, very different thing. Only a
Pardon
Texan
me.
would get that wrong. Yeah,
That's right. Forget about it. So let's use the city lingo. And basically, anybody with a beard or facial hair that's going to come between the mask and the skin, forget it. You don't have a seal. You're at risk.
Yeah.
So these surgical masks, even the best made surgical masks only block about 80 or block about 80% of these large viruses. Here's the problem. Coronavirus, especially this one that's causing COVID-19, is, in medical terms, as I said before, an extremely small virus. This thing is about on the order of 10 microns, or I'm sorry, 0.1 microns. Let me get that correct. It's 0.1 millionths of a meter in diameter. That's tiny. Now, here's the problem. The N95 masks that we hear all the hoopla about, these things only filter out 95%, mind you, not 100%, 95% of particles down to 0.3 microns. So these COVID-19 viruses are 0.1 microns. So here's the bottom line, Shannon. If you want to protect yourself by wearing a mask, then go find something that those researchers in the virology lab in Wuhan or in Galveston, Texas, or these level 4 virology labs, these spacesuits with the clear plexiglass screens and they have air hoses hooked up to them, just like NASA astronauts. That will protect you pretty well against viruses. Everything else is bunk.
Well, and this is what I've been saying, and thank you so much for the clarification on that. I really appreciate it, because you've justified some of the things that I've been putting out on social media and getting absolutely hammered for. And so the question here is, and you know, the other reason, one of the other reasons that I am opposed to wearing a mask is that we now know, and Stanford study, there are studies now coming out from Yale, from Carnegie Mellon, from the USC report that was released about LA County, and the fact that this virus is much more prevalent. It's much more, it's been in the country for longer than anyone else has thought. And it's much less deadly than anyone. I mean, there's so many studies out there right now that I could point to. And the idea here, though, is that, and this came out of Carnegie Mellon study, is that this horse has left the stable, right? It is already out there. And so we're only prolonging the agony. The longer that we shut down, we are just delaying something that is inevitably going to happen anyway. And for me, I feel as if we're going to virtue signal, I think it's my civic duty to go out and to get COVID-19, and for my kids to get COVID-19, because most likely we won't have any symptoms at all. Or if we do, we'll have mild symptoms. And if we have some more severe symptoms, then we'll probably be fine too. The fact is that 99% of us will be okay for the most part, based on some of the new studies. And so it is better for us to go out into society and let this thing play out, so that the majority of society builds up this natural herd immunity, and then we'll be able to protect the most vulnerable among us. So that's the other reason that I'm opposed to wearing these masks. But here's the other angle to this, because we looked at this from a scientific angle. There's also a political angle. The question is, why then? Right? Why? Because there is so much research. Everybody knows this. Everybody
Yeah.
knows this. In fact, if you can go to ABC, CBS, NBC, New York Times, you can go to all the major outlets and you will find stories where they say masks don't work, or
Yeah.
they admit it. So what is the insanity? And what I'm concerned about, and this is something from a political, I think that they have more in store for us. There's a tactic in sales, and I was a salesperson for 15 years before I became a talk radio host. And it's a tactic used if you're going to manipulate someone or get them to do something that they might not want to do. And it's the little ask, and then the slightly bigger ask, and then the big ask. Right? You
Mhm.
condition people to get used to doing things that might be frankly absurd.
Well,
And
Simon says, yeah.
they might be uncomfortable with, but if you can get them to do the little things, then when you move to the bigger things, they have already established this behavior pattern.
Yeah.
And what I'm looking at, and what I know that they are planning, we are going to be talking about giving up your information in terms of surveillance, allowing the government to access your phone so that they could do case contacts and track people and try to track the virus, which is frankly ridiculous. I think that they are working on forced medical testing. You want to go
Yep.
back to work, you have to prove that you have the titers
Or forced
the
vaccination.
antibodies,
Yeah.
or forced vaccination. And
Right.
these are all things established. We went through this with the Nuremberg trials. And it has been clearly established. This would be a major ethical breach, I believe, in the field of medicine, if they were able to get past this. And so that's the other. I mean, there's more to my thinking. It's not just I'm just a defiant girl who doesn't want to wear a mask.
Yeah, sure.
I think that this is just the beginning of some bigger asks, some larger asks that are going to be clear violations of our constitutional rights.
I'm not sure. I'm not even so sure it's going to be an ask.
Well, yeah. All right. Well, let's talk about that. When we come back, we'll get into this, because I want to ask you about the medical ethics of that and where I'm concerned that we're going. We're talking to Dr. Kevin Wacasey. He is the author of HEALTHCAREONOMICS. You can find him on Twitter. His handle is @HCOnomics. We'll be back in a moment on News Radio WHAM 1180. Welcome back, everyone, to the Shannon Joy Show. Thank you for joining us tonight. I am joined by the gosh darn handsome Dr. Wacasey. That is your new name. And I really appreciate you coming on. And we're talking about, I mean, we basically in the last segment talked about the futility of the mask. That even the best medical grade masks are still not, with a virus as small as COVID-19, they aren't going to do much to not only protect you, but other people. And that's what I hear all the time on social media. Well, it's not about protecting you. It's about protecting the other more vulnerable people out there. And I'm like, I don't even get what they mean by that.
Let me say this. If I'm wearing a mask, it's about protecting me. Okay.
Well,
I'm
right.
just sorry. I'm an ethical guy, but hey, yeah, it's about me.
And so, we've established that masks don't work, and there is a large body of evidence. If y'all email me at theshannonjoyshow@gmail.com, if you want me to gather up all of my articles and this research studies, I will send them to you, because I source my work. But I wanted to ask you, because I have seen this going around, Dr. Wacasey, on social media, this idea, and I wanted to run it by you first, because you hear these anecdotal stories, but people are saying that it could potentially be dangerous, to where when you're talking about a situation where Andrew Cuomo is saying to New York State, if you want to open your car dealership, if you want to open up your barbershop, if you want to open up your retail establishment, and we've now deemed you eligible to open, you have to wear a mask all day. And if you're going to be out, and Dr. Mendoza, who is our county health official, just came out saying that New Yorkers are going to have to get used to this new normal, that masks are going to be a way of life for New Yorkers. Now, the question is, people have talked about breathing in your own carbon dioxide. I don't know if that is real. The health implications of wearing a mask, covering your mouth and your nose all day long, every day for extended periods of time. I had friends who talked to some of the workers in Wegmans who are now forced to wear the masks, and they hate them, and they don't feel good at the end of the day. And so I wanted to ask you about that. Are there, from your perspective, is there any kind of health risk to forcing people to wear masks all day long?
I would say the health risk is minimal. The rebreathing of CO2, that's very unlikely to cause any problems unless someone has severe underlying respiratory disease. But of course, if anyone who's worn an N95 mask, which, as I said in the last segment, is practically useless against something as small as this virus, COVID-19, that causes COVID-19. If you wear an N95 mask for more than about 30 minutes, you're ready to take that thing off. I mean, it's hot, it's moist, it's uncomfortable. It's a lot of pressure against your face. Again, folks, if you are not forming a very tight air seal against your face, and I challenge anyone out there to try and do that don't try and do it with a bandana. You'll choke yourself to death. But basically, if you can't form an air seal around your nose and your mouth, you're breathing in the outside air. You're not even filtering all the air you breathe through that mask. So the health benefits, I would say that that's not as serious a concern. I will tell you this, though, and as an aside, I think it's really funny. I just thought of this, but it shows the idiocy of a government, Shannon, who is now preaching that we all need to wear masks. At the same time, they're pouring billions of dollars into mass facial recognition systems. So the government, it just goes to show you, folks, how idiotic the government can be when they're telling you to wear something that is useless and worthless, but it's also self-defeating.
All right, Dr. Wacasey, sign me up for the mask. If this is going to keep me from the government surveillance, the drones are flying around. Yeah. Okay, that's how you'll get me to wear.
They'll still be able to take your temperature, unfortunately, but yeah.
Now, in the last segment, I moved into this, and I want to get to this discussion with you. Last night on Facebook and on Twitter, I posted a documentary that I have actually watched a couple times. It's one that I featured and I used on a few programs I did about a year ago about the eugenics movement in not only Germany, but the United States of America, right around the turn of the century. It was the hot new science. Everyone bought into it. It was established science, and we know now it was quack science. It was the science that was used to justify the Holocaust and the mass killing of millions of Jews in Nazi Germany, but also to justify prior to the Holocaust. What people don't realize is that in Germany, they had prepared the German people for many, many years prior to the brutal slaughter of the Jews for mass government killing. And that was through their euthanasia programs, their T4 action programs. They were euthanizing the disabled, the handicapped, the elderly, children for many, many years before they ever got to the Jews. And all of that was justified by science and medicine, and it was carried out in large part by a medical establishment that had become political. Yeah. And this is one of the things that I want people go bonkers when I start talking about Germany and Nazis. You can't compare what's happening now to what's happened then. And I say, well, of course you should.
The erosion of rights none of that happened in Germany overnight.
Absolutely. Well, and when you look at Germany, they were an industrialized nation. They were highly technical. They were wealthy. This was a first world nation that descended into evil, into darkness so quickly that it boggled the mind. It shocked the conscience of the entire world that could happen. Yep. And in this documentary, the killing nurses of the Third Reich, they document how doctors and nurses were slowly over time propagandized, coerced, and manipulated into carrying out these dark plans that were put in place to really support a socialistic healthcare system. That efficiency. Right. You don't want to waste beds. Now, in the testimony at the Nuremberg trials, because people couldn't figure out how nurses could do this, and they established that in many ways it was these little asks. If you were a nurse in one of these T4 action hospitals, there were a half a dozen of them across Germany. They would start by, you would care for some of these patients before they were euthanized. And then the nurse, then they say, well, a couple weeks later, you'll walk the patient down the hall. They won't go into the room, and but they'll bring the patient to the room. And then they slowly over time would bring the nurse into the room, and then she would be there when the lethal injection was administered, when the feeding tube was removed. And it was little by little. It was the little ask and the big ask. But it also detailed the politicization of healthcare. I'm concerned about the medical ethics right now in this country, and people think I'm bonkers. Do you think drawing those parallels is too much?
Oh, no, absolutely not. Look, physicians go through a lot of training. I spent my 20s learning how to become a physician. Literally, I spent 11 years after high school, getting educated and trained to do this. That doesn't mean that I'm Superman, impervious to all suggestion and or forceful will. And it doesn't mean that a physician is not subject to some of these crazy ideals. Look at the one of the architects of Obamacare, Dr. Zeke Emanuel. I would say that this guy's much closer to what you're talking about. He was talking about the mandatory death age of 75. He doesn't want to live past 75.
Right.
Well, hey, man, if I'm 85 and still mowing my lawn, I want to be living, okay?
Absolutely.
But what's interesting, Shannon, is this already exists. Nobody knows this. Not many people really appreciate this. But the NHS, the famed National Health Service of the United Kingdom, does this. They euthanize patients. And if you don't believe me, watch a documentary written and produced and starred in by a good friend of mine. Colin Gunn is his name. He's a Scottish filmmaker, has a wonderful accent. I can do a Scottish accent just like him.
That's
But
good.
he's a great guy. He did a film a few years ago called Wait Till It's Free. And he details the NHS system and how they literally bump elderly and disabled and sick patients off by euthanizing them with drugs. I'm not kidding. I'm not joking. And it's widely done over there. It's not well known over here. And it is unfortunately a byproduct of a socialized healthcare system. You have to get rid of the chaff so you can promote the wheat.
Well, and I have to say I've been quite uncomfortable. The last time I checked, we had shut down every nursing home in the country, and family members are not allowed. It makes me I don't know why, it makes me feel weird. I don't like it. I do not like it that these are just simply locked down right now. It just, I don't know. It's something that I am concerned about. All right, we have to end the program, Dr. Wacasey. It flew by. Thank you so much for being with me. How can people find you if they want to purchase your books or if they want to follow you on social media? Go ahead.
Just remember HealthCareOnomics, healthcare and onomics put together. If you Google that, you'll find it. I have a blog called healthcareonomics.com. I'm on Twitter, I'm on YouTube, and I'm on Parler and Gab as well.
Awesome. All right. Thank you so much. And thank all of you for joining us tonight. If you want any of the resources or any things we talked about today, feel free to email me at theshannonjoyshow@gmail.com. Stay tuned. Keep it here at 1180 WHAM because Michael Savage is up next.
Now you can easily compare health insurance plans and pick the one that makes the most financial sense with the Dr. W's Equation app, available for Android and iPhone. And for more information on how you can save on health insurance and healthcare, check out my books, available now on Amazon, iTunes, and Nook. To help spread this message, please click the like button on this video. You can also subscribe to the HealthCareOnomics YouTube channel and visit healthcareonomics.com.